Deputy Speaker.
Order.
Resumption of debate on Singapore's COVID-19 response, a motion standing in the name of the Deputy Prime Minister and Minister for Finance.
Ms. Rachel Ong.
Mr. Deputy Speaker, the overwhelming scale and speed at which COVID-19 unfurled in the migrant workers' dormitories caught Singapore off guard. But because of the selfless and immediate contributions of our first responders, medical workers, volunteer groups, individuals, public sector agencies, and their collaborative work with the Ministry of Manpower, Singapore was able to react swiftly to care for our migrant workers. As the dormitories went into lockdown in April 2020, the interagency task force supported migrant workers and dorm operators in the large purpose-built dorms that each housed several thousand of workers. They ensured timely access to food and medical services and looked into the hygiene and cleanliness of each dorm. Despite the mammoth task of having to secure and distribute food to tens of thousands of workers on extremely short notice, several misses in food quality, cleanliness at the beginning, the gaps were promptly addressed. At the same time, our medical workers dived in full-on. Doctors from various specializations closed ranks, all to serve migrant workers in A&E wards and mobile clinics, risking their own lives for the migrant workers as they fought a then unknown virus. Concurrently, NGOs came in to support the well-being of those in the smaller factory-converted dormitories across Tuas, Jurong, Kranji, Woodlands, and Ubi. These amazing organizations include HealthServe, Migrant Workers Centre, COVID Migrant Support Coalition, Alliance of Guest Workers Outreach, and Crisis Relief Alliance. Volunteers took the effort to walk the ground, talk to migrant workers to identify where the FCDs were, and searched out those with limited access to daily essentials. NGOs supplied food to these FCDs where employers did not, went the extra mile to cater to early morning food deliveries during Ramadan, which fell during the lockdown period. Apart from care packs, some provided SIM cards with data plans so that the migrant workers could occupy themselves and stay in touch with their families. The NGO volunteers also unexpectedly served as community mediators. Under lockdown conditions, tensions rose in some dorms between workers across different faiths and nationalities. I understand from one of the NGOs that without the volunteers' intervention, one of these conflicts would have led to bloodshed as weapons had been involved. We must also remember individuals such as Ms. Sudisna Roy Chowdhury, then a fresh graduate from a medical school. Within 8 hours from the breaking news of widespread infection in the dormitories, she produced a website to provide English-Bengali translations for clinical consultations. We shall also not forget the many individuals who have stepped forward to serve as interpreters in medical, formal and informal service settings. The selfless and collaborative spirit between the government, medical workers, NGOs, and members of the public in the early days saved lives. Thank you. Over time, we saw MOM move to make further improvements to the well-being of our migrant workers. Updates to accommodation standards, quick and prioritized vaccination rollout for the migrant workers, and the quick development of FLW Mom Care app that give workers access to prompt and accurate information, including medical services. MOM also worked with employers to give workers online access to salary accounts and remittance services, a service that is greatly valued by the migrant workers even till now. Meanwhile, NGOs continue to support the mental well-being of our migrant workers by organizing social activities, celebrations, outings, and the provision of telecounseling services. Their commendable work continues today. Mr. Samuel Gift from the Alliance of Guest Worker Outreach shared that one positive outcome of this crisis response has been a greater trust in the migrant community for our authorities. This is credit to MOM's ACE team, who showed up meaningfully for the migrant workers when they needed help. One migrant worker shared that they used to worry that if they spoke of any regulatory lapses in the dormitories to MOM, they would lose their jobs. But because of the ACE officer attending to their case took time to build trust, they felt safe to freely share their concerns, knowing that their identities would be kept anonymous. To the ACE officers who have labored much on the ground to care for our migrant workers, what a tremendous difference you have made in the lives of our migrant workers. For all the good work that was done, I understand that the government's motivation for the white paper is not so much a pat on the back, but to bring light to blind spots so that Singapore will bounce back stronger in our next crisis. I wish to highlight 5 lessons and actions for consideration from the migrant workers' dormitory crisis, with a focus on the smaller FCDs that house a third of the 300,000 workers staying in the dormitories. First, enforcement of regulations in FCDs. The COVID crisis in the dorms was perpetuated due to the poor living conditions. This is most evident in the smaller FCDs that were not regulated by FIDA. However, the call to improve living conditions in the FCDs had been made years before the pandemic started. In July 2016, Migrant Workers Centre had published photos of the poor housing and hygiene conditions of some of the FCDs and flagged the issue to MOM. In response, MOM announced new and improved living conditions that must be met by FCDs starting 1st January 2017. The 4 conditions include the provision of feedback channel for workers to report issues related to the housing conditions of SCD, provision of personal locker for each worker, provision of at least 1 sick bay in the FCD. Alternatively, the operator can develop a contingency plan to deal with cases of infectious diseases. And last, provision of Wi-Fi within the FCD. As NGO volunteers have witnessed while supporting the FCDs during the crisis, many FCDs did not fulfill the above condition stimulated by MOM. If a contingency plan for infectious diseases was indeed in place, could COVID crisis have been better dealt with within the FCDs? It appears then that there was a lapse in the monitoring and enforcement of these new conditions, and the FCD operators were supposed to have met since 2017. MOM had also launched a Dorm Watch app in 2018 with the intention for it to be used by migrant workers to give feedback to dormitory operators on issues faced at the dorm. However, NGOs reflect that few migrant workers used the app as many were concerned that reporting issues would cause trouble to their employers and hence also put their jobs in jeopardy. As I understand, the Dorm Watch app was eventually evolved to be used by dorm operators to manage their list of residents for MOM reporting and will be discontinued later this month in March. I believe the original intention of the Dorm Watch app remains relevant today and would serve the migrant workers and dormitories well. In leveraging the trust ACE team has built with the migrant workers since then, may I propose that the ACE team conduct a survey with the migrant workers to better understand how feedback on dormitory issues can be received from them in a manner that they feel safe to provide. If an app remains the best means for the workers to give feedback, it could be integrated in the FW Mum Care app that the workers already use on a regular basis. To summarize, as FIDA kicks in for the FCDs on 1st April 2023, for the safety and long-term resilience of our migrant workers in Singapore, we must learn from the lapses of 2017 and its impact during the pandemic. It is encouraging that we have set in place new regulations and standards, but as we have observed, what is needful is the ongoing monitoring and enforcement of regulations over the FCDs, as they tend to be most prone to lapse in living condition and require greater support. I trust MOM will do the needful. Second, accountability by employers of migrant workers residing in FCDs. As mentioned earlier, at the start of the pandemic, NGOs stepped in to serve migrant workers in FCDs that were left by their employers to fend for themselves. Some migrant workers had been without food for 2 to 3 days before the NGOs found them. Meals were supplied to the FCDs for an extended time period between 8 to 12 weeks, before NGOs put a hard stop to food supply after informing MOM, calling for employers to be more responsible for their workers. The question begs, why did it take so long for employers to step in to care for the workers? Some employers reflected, given the pandemic and lack of business outcome, that they were financially unable to support the cost of providing food for their workers. However, employers could have taken ownership to work with MOM or the NGOs to support the migrant workers in other ways, especially in maintaining lines of open communication, updating the workers with key information, or providing assurance of income. This, instead of leaving the task to NGO or going off the radar, as it was in the case for some FCDs. I would like to ask MOM whether and how these employers have been held accountable for their unacceptable act of leaving their workers without food access during the height of the pandemic. I would also like to ask MOM two further questions relating to our crisis response moving forward. First, what are the available means by which employers with genuine needs could flag for help during a crisis, so that workers are not left to fend for themselves due to cost pressures? Second, how will errant employers be held accountable in the event that they abandon care their workers as they did in this last crisis? Third, including migrant workers in crisis communication. One of the greatest challenges faced at the start of the crisis was communicating with the migrant workers who spoke different languages. Even NGOs struggled with this, as some were not resourced with volunteers that spoke different languages. Without a crisis communication system that incorporated the workers' native languages, there was much confusion as quarantine measures saw frequent changes and workers moved from one place to another. Some workers were uncertain if having COVID meant certain death and if they would be left to perish. With the dearth of information in their native language, workers sought information from alternative news sources from their home country, which may not have provided accurate reflection of the situation here in Singapore. The missing communications also negatively impacted the migrant workers' health-seeking behaviors during the onset of the pandemic. Some workers who fell ill would not seek medical help and continued to head to work out of fear that their income would be affected. Clear communications in their native language, providing assurance of their income and jobs despite contracting COVID-19, would have made a difference. I'm glad to hear that now, through the FW Mom Care app, essential health information and MOM advisories are now disseminated in the various native languages of the migrant workers. This recent crisis is a reminder that we must include our migrant workers' population in crisis communication, especially when it concerns public health. I trust we will continue to leverage the app to provide centralized and timely communication to our migrant workers in our next crisis. Fourth, identifying the multinational representatives within dormitories. As workers from different nations do not always enjoy friendly relations with each other, NGOs have found that in migrant workers' communication, it was helpful and important to have a representative from each nationality staying in each dorm. Where this was missing, NGOs faced situations where food or resources were not evenly distributed to workers from other nationalities in the same dorm, leading to even greater tensions. Moving forward, MOM would consider the nationality profile of each dorm and then identify representatives for each nationality. These representatives can help with the prompt dissemination of information and fair distribution of resources. This will support the work of the dorm operators in times of crisis. Fifth, coordination of NGO resources. Given the scale of the dormitory crisis, many NGOs and informal groups stepped forward to serve the workers in whatever way they could and wherever they saw the need. However, NGOs had observed that this led to some dorms being overserved and others underserved, as there was no coordinating body across the NGOs. May I propose for the government's consideration for MOM to provide a platform or coordinating body that could support a more even distribution of resources provided by NGOs or informal groups in times of crisis. To close and summarize, my speech calls for 5 things for us to learn from and act on. The first, MOM's enforcement of regulations to improve living conditions in FCDs. Second, accountability of employers of migrant workers residing in FCDs. Third, inclusion of migrant worker community in crisis communication. Fourth, identifying multinational representatives within dormitories. And fifth, coordinating of NGO resources in crisis time. We all know that infectious diseases are no respecters of persons. They do not discriminate between nationalities, social or work pass status. In a war against all or any pandemic, Singapore is positioned to win when we secure the safety of those most vulnerable amongst us. Let us close the health and safety gaps of our migrant workers and see Singapore win in the next pandemic. Mr. Deputy Speaker, once again, I'm grateful to our government, first responders, medical workers, NGOs, and volunteers for giving your best in our fight against COVID-19. May we never forget the good you have shown to our people in Singapore. Thank you.